So we're going to deal with 5 review articles in this journal course. And what we're going to do with this journal course is hope that you'll read those articles yourselves. And what I'm going to provide for you is a little bit of color commentary surrounding these articles so that as you dig into them, you have at least my opinion as someone that's been involved with the medical literature and serves as an editorial board member for 2 major journals and as the education chairman for a major international society, so you can hear what I might think about these 5 articles, and then you can read them yourself and draw your own conclusions. It's certainly an educational process that gets us familiar with evidence. So there are going to be 5 articles that we deal with, and they're going to deal with 5 concepts in athletic hip medicine. Okay, the first is what's called the layer concept, utilization in determining the pain generator's pathology and how structure determines treatment, by authors Pete Drayovich, Jamie Edelstein, and Brian Kelly from the Hospital for Special Surgery in New York. The second article, the etiology of primary femoroacetabular impingement, genetics or acquired deformity, introduces a very interesting discussion and thought concept for those of us involved with athletes about how do our athletes get hip impingement, and it's definitely something that authors John Packer and Mark Safran from Stanford give us great food for thought and establish a basis for understanding. We're going to go right back to those same authors for article number 3, and that is micro-instability of the hip, another category of athletic diagnosis. And the article titled Micro-Instability of the Hip, It Does Exist, Etiology, Diagnosis, and Treatment. And in this article, Drs. Christoforetti and Safran are going to go back through their process of understanding a new diagnosis of micro-instability inside the hip. It'll help you get some understanding, and I'll give a little color commentary to that article. The 4th article is going to be about trauma, and we're going to deal with a common athletic diagnosis that's not really a very common diagnosis, but it's something that happens in the hip traumatically, trainers may see, and that's fracture dislocations of the femoral head, and we'll hear from Dr. Reyna and his group on that. And finally, and importantly, we're going to talk about defining terms in this journal club, and we're going to go to the Journal of Hip Preserving Surgery and a multi-author study that is called the 2019 International Society for Hip Arthroscopy and Preservation Physiotherapy Agreement on Assessment and Treatment of Femoroacetabular Impingement Syndrome, an international consensus statement. So hopefully these introductions to what our journal club is about and to the articles themselves will help enrich your enjoyment and understanding of the modern evidence surrounding treatment in athletic hip disorders. And this is helpful to you in your learning towards these goals.